Did you know that in your lifetime, your mouth will produce enough saliva to fill 2 swimming pools?
Wow!
Amazing people do lots of important jobs inside and outside hospitals that help to keep you safe.
But what will happen when we have a go?
I feel a bit silly.
This is Operation Takeover.
Can you guess who today's hero is? Well, I'll give you a clue. You might have to food them if you've
You're a bit hard to understand. That was a rubbish clue, Chris. We're about to take over the job of today's hero, dental surgeon Anita.
Anita is a top trainer at the King's College London Dental Institute.
Now, how important is it to look after your teeth?
It is incredibly important to look after your teeth. Brushing morning and night for 2 minutes and to try and not eat too many sugary things, fizzy drinks especially.
So how often should you see the dentist?
You should really see the dentist every 6 months.
What? Anita, Dr. Xand is very proud of his teeth and he would like to show them off to you. Would you mind having a look at them?
Absolutely, that's no problem.
He's such a show-off. Here we go, Xand. Open wide.
Right, 8, 7, 6.
If you've ever wondered what on earth your dentist is talking about when you're in the chair, here's how it works.
Each tooth is given a specific number according to where it is in the mouth. Any milk teeth that you still have will be given a letter.
And what kind of common problems are you looking for?
I'm looking to make sure that you're brushing properly and that there isn't any decay in your teeth. Xand's done very well and he doesn't have any.
Very impressive, Xand.
Before we're let loose on today's takeover challenge, we need a masterclass. But I've no idea who we're going to practice on.
We use something very special. We use a phantom head.
A phantom head?
Oh, come on, Xand. Really? The phantom, or model head, is used by students to practice doing fillings. You start by putting in a suction tube to remove any extra saliva so the patient doesn't choke.
Next, you use the drill.
Cool.
Attaching the drill bit with a steady hand.
There you go.
Clicks in.
Then we're going to imagine that this tooth has a little bit of decay in it. And so we're going to cut a little teeny tiny hole.
In goes the filling.
We're going to use a white filling material called composite.
Which is set hard using an ultraviolet light. Wow.
So we cover it so that it doesn't hurt our eyes. And then if you touch it, it's gone completely hard.
Amazing.
Thanks, Anita.
We've seen just how important dentists are for keeping your oral health in tip-top condition.
But will we be able to brush up on our skills enough to make our careers as dentists sparkle? Come on.
It's time for us to take over as dentists.
Your challenge is to perform a filling on the phantom head. The first part is to remove the decay and the second part is to put the filling in. I'll be judging you on your professionalism, your technique and how well you make it look like a real tooth at the end.
You know what, Chris? I've really got this challenge. Anita thinks my teeth look great, and now that I've overcome my fear of the phantom heads, there's really nothing to worry about.
Oh, you've overcome your fear, have you? Well, this won't bother you at all.
Come on, Chris. It's time to get our teeth into this.
No problem.
First of all, we get out the drill, put that right in. OK.
That's very good.
Hello, sir, or madam. Drill. Oop. That was...
Whoa!
OK.
Health and safety, Xand.
Before you take your eye out and press the back
perfect.
goes in and it locks it.
So, first big mistake.
So we've got to lock the drill bit into the handpiece. It can fly out and then that could hurt somebody.
It's a bit nerve-wracking because it looks so much like a real tooth. I kind of don't want to drill into it.
I'm drilling already.
What about the suction, Smarty Pants?
So he's forgotten to turn his suction on.
That's embarrassing.
So if it was a real patient, they'd be gurgling.
I'd focus on yourself rather than me, Xand.
Oh, he's got his hands in the patient's eyes. We don't do that usually.
Come on, slow coach. I've moved on to filling.
Right behind you.
I had to use quite a lot, and I think I may have drilled out a little too much tooth.
Oh, Xand.
I mean, it's very clear now why people have to train for years and years how to do this.
Just need to set it with the UV light.
Probably enough.
And, right, thanks very much, sir, or madam. You can go on your way. Well, I think I'm done. A satisfied customer. You can close your mouth now.
Not sure he's impressed. Fingers crossed Anita is.
Time for the verdict.
Anita, how did we do?
Well, you both tried really hard.
That's not good. That is not good.
On for the professionalism, Xand, you did put your fingers in the patient's eyes.
I was in a place to rest my hand.
Technique-wise, Xand did take a bit more tooth off than we normally would. For the final product, actually, you were both not too bad.
So what's the verdict?
Chris.
Oh! I guess I wasn't expecting to lose.
What, because you'd had such a good time?
I'd begun to believe that I had become a dentist.
Well, Xand, you may have felt like a real dentist, but you're not a real dentist. That is job most certainly best left to the professionals.
Anita, I think you better have our coats back.
Fabulous.
Your body can need mending in all sorts of ways. And today, we're going to meet Yasmin and Ryan, who are both having their teeth fixed.
If you've got all your adult teeth, you should be able to count 28 of them. And that's it for the rest of your life, except for a few sneaky wisdom teeth that might come through later on. But often, when your adult teeth have come through, they need a bit of help getting straight. It's a dentist's job to make sure they're all in the right place and that your teeth and jaw work correctly and give you a winning smile. So love them or hate them, dentists are here to help you.
Dentists can move the position of teeth with a brace, and Yasmin here is having her braces fitted today, and they're a very cool fashion statement at Yasmin's school.
So the other kids actually want to have braces?
They look like kind of cool and you can get different colours.
So you're going to have the best braces in school?
Yeah.
Making Yasmin look cool today is consultant orthodontist Vicky Elton.
So what's Yasmin going to have done?
Yasmin's already got a removable brace at the top of her mouth, which is moving her bite slightly. And today we're going to put a fixed brace on her bottom teeth.
At the moment, Yasmin's teeth don't bite together correctly. The new brace will not only straighten her teeth, it'll make her teeth fit together nicely when she bites and avoid her getting jaw pain as she gets older. So, it's time to fit the new brace. First, Vicky glues the brackets onto which the wire will be attached.
You're right there, Yasmin.
Yeah.
What's that?
Yeah.
It's not very talkative.
Right, that's all done. So next we're going to get the wires in.
And it's the wires that pull all of the teeth into place. Now Yasmin gets to personalise her brace by choosing some colours.
We're going to have light pink and teal.
Nice choice!
So we're going to attach little elastics now.
Not only are these decorative, they are really important.
So can you see that the little elastics are holding the wire firmly into place in each bracket?
Yasmin, you chose the perfect colours. You look great.
So that's Yasmin's new brace fitted. In a few months, her teeth will be straight, and most importantly, she'll have a better bite. What does she think?
I like it.
You did very well with that colour choice.
So your second set of teeth, or adult teeth, can come through all higgledy-piggledy and need straightening out.
But occasionally, doctors actually need to create space so that teeth can come through in the right position. And that means some teeth have to come out.
This is Ryan, and although it looks like he's got no front teeth, he's actually got 2 sets. This is his X-ray. Ryan's lost all his milk teeth, and all his adult teeth are in place, except for the front 2. See that gap? Now look above. There are his adult front teeth. But they're being blocked from growing down by 2 more teeth.
So what are they going to do in the operation?
We're going to take the 2 teeth out from behind and then so the first ones can come through. And then after that, they're going to stitch the gum back up so it can heal.
So the 2 extra teeth are going to be removed. Will he put them under his pillow?
Too old for it.
No, you're too old for it. I'll tell you what, give them to me and I'll put them under my pillow. We can split the money.
And no, this isn't the tooth fairy, it's oral surgeon Mr. Eric Andresen. Ryan won't feel a thing during the surgery, and that's his mouth right there. And both sets of teeth are in his gums.
There and there is where the teeth are going to come through.
It might look icky, but the surgeon needs to make room for Ryan's adult teeth by removing the 2 extra teeth.
So we're only a few minutes into the operation, but we can already see Ryan's adult teeth up there. They're fully formed, they're just not in the right place.
Having his adult teeth in the right position will mean Ryan can finally bite into hard foods like apples, but it will also mean he's much less likely to get an infection. If you're squeamish, look away. But with his spare set removed, now Ryan has enough space for his adult teeth to come through. I actually saw your teeth being taken out, and I took a photo of the little teeth. Do you want to see it?
Yeah.
That is them there. Is that what you thought they'd look like?
No.
Thought they'd be smaller? So remember, if you have to have your teeth worked on, it's all for the good, and you'll get an amazing smile. I might keep hold of these. The Tooth Fairy will be paying out tonight.
And now to our lab for some amazing body experiments.
Ugh! Whoa! Just don't try anything you see here at home.
Take a look at this. It's a skull that's over 100 years old. Now, it's from a 5-year-old, but look carefully and you'll see why I really wanted to show it to you. This skull has 2 sets of teeth. These are milk teeth, and these are adult teeth. They're waiting to come through when the milk teeth fall out. But what's amazing about this is that it's not amazing at all. If you're still waiting for your adult teeth, just think they're already in your head, fully grown. Underneath your skin, your skull will look just like this one. Both sets of teeth are coated with enamel. It's the hardest substance in your body. It's even harder than bone, but it's not indestructible, as we're about to find out.
Does my breath smell bad?
Yes, it does, actually.
I'm not surprised. I haven't brushed my teeth in 2 days.
But it's all for a good cause, isn't it, Chris?
I hope so.
In fact, it was my idea. While I've been brushing my teeth twice a day, as you should, I haven't let Chris brush his at all for 2 days. But it's all in the name of medical research.
My teeth feel fuzzy.
That's because Chris has a layer of plaque building up on them. Open wide.
I'm going to show you why plaque isn't something you want a lot of. When you go to the dentist, you'll have had your teeth scraped like this.
Going anywhere nice on holiday this year, Chris?
No.
Oh, lovely. I've been there. It's wonderful at this time of year. Oh, Chris, this is disgusting. Plaque is a mixture of food particles, acid, and bacteria.
We've all got thousands of different bacteria living in our mouths, and most of them are harmless. But there are some bad ones that can turn the sugars in the food we eat into acid.
And it's this plaque acid that's the real problem.
It eats away at the tooth enamel, and that's what tooth decay is.
Please, can I have my toothbrush back now?
Soon. There's more to show you.
We're both going to rinse our mouths with a special blue dye that will show up how much plaque we have on our teeth. It's my brush gnashers first. Ta-da!
You look really funny.
You look funny.
Now, even though Xand has been brushing regularly, you can see that some dye has stuck to his teeth, and that's all plaque.
That makes me a bit worried, because I haven't brushed my teeth for over 2 days.
Why'd you do that?
It was your idea.
Well, after a quick rinse with the blue dye, it's time to check out the state of my unbrushed teeth.
Oh, there's plaque everywhere. How do you let this happen? So, if you compare my lovely clean brush teeth with Chris's disgusting unbrushed teeth, you can really see the difference. And all that plaque has built up in just 2 days. That's gross.
I feel quite disgusting. I would like my toothbrush back.
Nope.
I want to get a much closer look at your plaque, Chris, which is why I've put a dollop of it under this microscope.
Look at this. Wow! So these bacteria are the ones that live in my plaque. And although we can't tell which are the good ones and which are the bad ones, some of them are the ones that produce the acid that is rotting my teeth right now.
Yep, and if you just leave plaque, it hardens like cement. That's called tartar, and it builds and builds. It can damage your gums and give you rotting teeth that look like this.
Not a good look. That's it, I've had enough. I am gonna brush my teeth.
No, he's not.
Can I have the next patient, please?
Back at the Ouchmobile, 10-year-old Izzy's chompers need checking.
So, Izzy, why have you come to the Ouchmobile?
I've got an out-of-place tooth.
What's the diagnosis, Doc?
Sounds to me like a case of I've got an out-of-place tooth-itis.
Tooth-tastic.
Now, how long have you had the tooth out of place for?
About 2 years.
Can we have a better look at it? Can you open the eyelid on the ouch cam? Now, it's an adult tooth, right?
Uh-huh.
Now, does it bother you having the tooth be wonky?
Not really.
Do you have any questions about the tooth?
Why is it wonky in the first place?
There are all kinds of reasons why it might be wonky. But one of the reasons is that your mouth is too crowded. And if your teeth get crowded, then some of them just get pushed out of the way to kind of make room for the others.
Will it go back naturally or with braces?
It might go back naturally, and we don't know with your mouth yet because you've still got a lot of your baby teeth and you've only got a small number of adult teeth. But I think it's most likely that you'd need braces to kind of get it right back in exactly the correct position.
Yeah.
Well, Izzy, thank you very much for bringing your amazing wonky teeth to the Ouchmobile.
It's okay.
Job done for today. Clinic closed.
We're giving you exclusive access to an accident and emergency department.
Well, come on, let's meet the first patient.
All right. At the Royal Manchester Children's Hospital, 7-year-old Logan has come in with his mum and a rather unique ailment.
Whoa, what's happened to your cheek?
The cheek looked like a hamster cheek.
So you're a cheeky little hamster.
No, I'm not a hamster.
Are you sure?
No.
OK, let's find out how he got that swollen cheek. Logan was cosily tucked up in bed when a pain in his tooth disturbed his sleep.
Hello, who's this little fella?
Keep up, Xand, it's a hamster. Anyway, Logan had taken his nasty gnasher to get fixed by a dentist before, but the painful problem came back.
Ooh, nice swag bag, Hammy.
What? Focus, Xand.
Whoa, OK.
Logan didn't feel like himself, and so woke up his mum. Not only did he have a sore tooth, he had a red, swollen face too.
Oh, so that's where the hamster comes in. Ouch! Someone who does understand Logan's torturous tooth is Dr. Alex Trott.
What's been happening, Logan?
It's been sore, and it's turned into a hamster cheek.
Right.
I've got shine here, and it's bright pink.
OK.
And inside, I've got a tooth, and it's got a big black hole in it.
A black hole? Well, that's a thorough rundown of your ailments, Logan.
Can you just open your mouth for me? I'm just going to have a look at the torch there.
Dr. Alex needs to spot exactly where all this pain and swelling is coming from.
Sore up there.
Yeah.
So, what do you reckon, Doc?
OK. It's a dental abscess.
Yeah.
It's quite a nasty one. So it's one of these top teeth. I think it's his back baby molar tooth, and that's where the infection's sitting. OK.
A dental abscess is a collection of gooey pus that forms in the tooth or in the gum and is caused by a bacterial infection.
First, it's off to X-ray for a proper look.
Come closer, your chin on here, your bite on there, and it will be done in a minute. Good boy, really still. OK, well done.
That's the problem tooth right there.
It needs fixing, so we'll catch up with Logan a bit later on and find out what happens.
Did you know no two people have identical sets of teeth?
Your teeth are as unique as your fingerprint, so be proud of your gnashers. And now to our lab.
It's time for some big body experiments. Some of them gory.
This is not for the squeamish.
Some extreme.
It's freezing!
We're ready. Are you?
Just don't try anything you see here at home.
Ah, Chris, you're just in time. It's 2:30.
So?
You know what happens at 2:30.
Is it time for your nap?
No! At 2:30, we go to the dentist. 2:30. Anyway, come on, we've got to get an X-ray of your teeth.
Fine, OK.
To the cupboard of everything.
Hi, Ellie.
Hi, Chris.
Hi, Ellie.
Wow, there really is everything in your cupboards, Xand. X-ray complete.
Now, this is called an orthopantomogram.
Oh, no, it isn't.
Oh, yes, no, it's not that kind of panto, Xand. The panto stands for the technique used, panoramic tomography. Now, the amazing thing about this is that you can see the whole tooth. If you look in your mouth, you can actually only see the top third. That's the crown, the white bit.
But on the X-ray, we can see what's below the gum. Your teeth have roots, and they're twice as long as the crown.
Now, that X-ray is really cool, Chris, but there's a lot more going on inside your tooth, and I'm going to show you using this huge model.
But Xand, we don't need a huge model, because today we've got the real thing. This is a tooth that's been given to us by a dentist that's been cut in half.
What? You cut the dentist in half?
No, Xand, the tooth has been cut in half. The dentist is absolutely fine.
For you. Now, your teeth are made of amazing stuff.
The glossy white surface layer is called enamel.
It protects the whole tooth, and it's the hardest substance in your entire body. But it can be worn away by acidic drinks and sugary food, and it won't grow back once it's gone, so look after it.
Now, underneath is the layer called the dentin, and underneath the dentin is the pulp. And they're sensitive layers of living tissue, and they support the enamel. They both contain nerves, which means that problems in your teeth can be painful. But have you ever noticed that your teeth are different shapes? Why is that?
Well, we're going to show you.
Only an edible experiment can answer that question.
Ta-da!
Why are you wearing that?
We need to have a good close-up look.
What Xand's trying to say is that he's ready for the experiment and he wants to have a good close-up look at the different shapes of teeth, so he's using a mouth stretcher.
That's what I said!
So let's have a look at the 4 different types of teeth in Xand's mouth, because they all do different jobs. At the front, we have incisors, 4 at the top and 4 at the bottom. Just behind the incisors, there are canines, and then just behind the canines, there are the premolars, and just behind the premolars are the molars. But why do we need these 4 different types of teeth? Well, we're going to find out in...
our terrific tooth testing test! We're going to see what happens when we bite and chew different foods using our teeth, but not our normal teeth of different shapes. We're going to be using these!
We both have a custom-made set of gnashers, but they're made up of only one type of tooth.
Xand has a full set of molars. So he's Team Molar.
Chris has a mouthful of canines. So he's Team Canine. Our challenge is to bite into a range of food and chew it.
Reveal the food.
Then, rather than swallowing the food, we'll spit it out and see which type of tooth has worked best.
First up, a sandwich. With soft food, Team Molar chews brilliantly.
Whereas Team Canine can bite, but definitely can't chew.
What you can see there is a perfect bite of sandwich, completely unchewed.
What about eating a hard apple?
I can't get any. I can't get any apple.
Team Molar is really bad at biting.
And Team Canine has a good bite, but can't chew it.
You should give it to me and I can chew it up for you.
What, and then give it back to me and I could swallow it?
No, that's disgusting.
And it's the same story with a steak.
I can tear it off easily, but then I can't chew it. Watch.
Well, I can chew it, but I can't actually get a piece off.
You're just pulverising it.
So, who won that one then, Chris?
Well, I don't think either of us did very well, did we?
What a disaster.
It proved exactly what we wanted, Xand. Only having one shape of tooth makes eating impossible. You need your sharp, pointy canines at the front for biting, and then your flat, wide molars at the back for mashing food up.
So, we've shown you that the crowns of your teeth are covered in a hard layer called enamel, and inside your teeth you have layers called dentin and pulp, which are packed with nerves.
And we've shown you that you have 4 types of teeth for a very good reason. Different shaped teeth have different jobs, and only by them working together can you eat safely.
Well, Chris, what better way to celebrate our teeth than with a brand new profile picture? What do you think?